Hi, it's Devon here again to talk to you about all things data. And today what I want to talk to you about are the common challenges that we're seeing in the healthcare space. Healthcare CIOs, whether you're running a hospital, an insurance company, an ancillary service like imaging or a specialist or some kind of clinic, you're seeing a lot of the same problems all across the board. And so I just want to talk about them a little bit right here. I don't have time to do all of them, so I am going to send you to my blog after this. Just make sure you click that link below, and then you can read about all of the common challenges in the healthcare space that CIOs are facing right now. But let's hit just a couple of the biggest ones. And the first one is probably pretty obvious to most or all of you: cybersecurity. You must protect that patient data. Aside from the fact that it's just good business, you don't want people having access to your client's stuff. That's common sense. But when you do get hit with an attack, and it is a when thing, it's not an if thing. Anybody who tells you that you're going to be 100% safe, just kick them out the door, okay? They don't know what they're talking about. So when you get hit, when there's an incident, and you have to go through your disaster response issues, you're going to get investigated. That's part of the process. And if you have failed in any way, you're going to get hit with massive, massive fines. If you want to avoid those fines, if you want to avoid disruption to your business, if you want to make sure that when those disasters come, that you're ready for it, not just for HIPAA compliance, but for business growth and continuity and being able to function, you have to be ready. So cybersecurity, protecting patient data, all of those things are critical, and it's the number one issue facing the IT stack of a hospital right now. I don't care what your job title is, whether you're CIO, a CISO, an IT manager, DevOps, application manager. Your job is security, first and foremost. And if you're not establishing roles and rules and business procedures and following them to a T, you are putting your entire organization at risk. You are putting your patients at risk. Hopefully not their lives, but maybe those too, since you're a healthcare organization. So make sure that you're doing everything correctly and protecting that patient data, period. Number two issue we're seeing across healthcare orgs right now is kind of contradictory. It's accessing patient data and using patient data. Now, it's not contradictory in the sense that it needs to be done, but as I mentioned before, getting the right roles and rules in place and enforcing them, that must be done to maintain HIPAA and to maintain the accessibility. Because it doesn't matter to me whether you've got your data in your pharmacy application, whether it's in your Epic EHR data platform, or whatever you're using. Your doctor needs to access it over here. Your pharmacy needs to access it over here. Billing needs it over here. Insurance needs it over here. The specialists need it down there. And all of that data needs to be interoperable. It needs to be clean. Doesn't matter if it's structured data or unstructured. You need to be able to use it and get it through the system. You need to make sure that you have identified a single source of truth, whether that's a full master data management implementation or some kind of data warehouse, whatever fits your environment best. You absolutely must figure these things out and make sure that your patient data is accessible to the people who are supposed to be able to access it, while also protecting it from the people who are not supposed to be able to access it. And once you figure that out, your company should be growing almost exponentially by default, because if your data is more accessible and faster, then you can see more patients every day. And that's one of the biggest things that's holding hospitals and doctors' offices back, is the speed of which doctors and nurses can go through their patients. If you're spending, an hour a day waiting for pages to load in an application, and you can get those pages to load in less than a second collectively, then that's an entire other hour you have to spend on patients and not waiting for slow applications. So cybersecurity, data performance, data interoperability, those are the biggest issues. If you want to learn more, follow the link, find the blog on the website, and let me know what you think. Shoot me an email or comment below right here. Thank you so much, and we'll be back with more about data in the coming weeks.